Hello everyone, I'm Dr. Srujana, Consultant Medical Oncologist at AOI Mangalagiri. So February is the National Cancer Prevention Month. On February 4th, the World Cancer Day is also celebrated in order to create the awareness about the cancer prevention and what are the symptoms, what are the treatment modalities. To make aware of the general public, this month we are giving the cancer awareness talks. These are being propagated. A lot of people are having doubts from different age groups about their cancer risks and the particular symptoms and treatments. So let's address these issues.
Hi ma'am, I am Bhavani, my age is 15. Can you catch cancer like a cold, not the flu?
Yes, cancer can come like a flu, but it does not go away like a flu. It will remain the same. The symptoms of cold, cough and fever with a normal flu will go off by 7 to 10 days. But with cancer, it will be persisting for more than 1 month. So why this happens? Because the immunity system is weakened because of cancer cells. The infection will not go out from your body because the blood cells are also decreased in number. So at your age, you'll be at risk for leukemias and the Hodgkin's lymphomas. They usually present with this flu-like symptoms, persistent fever, cold cough and unexplained weight loss, uneasy fatigability and night sweats, and these all things will be there, and you will be prone for repeated infections because of your weakened immune system.
Hi ma'am, I am Narmada, my age is 28. As a young adult, how often should I undergo cancer screening?
Yes, at your age, cervical cancer screening should be started. So the guidelines say from the age of 21 years to 30 years, pap smear is done every 3 years. Consult your gynecologist and get the pap smears done every 3 years. Between 30 to 65 years, you should be continuing the pap smear screening every 3 years, or the option of co-testing the pap smear along with the HPV DNA testing, which is done every 5 years, can also be done. So after 65 years, there will be no screening test. So one common question which I get from the young adults at this age, because a lot of cervical cancer vaccines are being advocated for prevention of cervical cancer. So once you get vaccinated, HPV vaccination, then is there any need for undergoing the screening test? Because I'm already vaccinated, I'm always protected. So this is a misconception. So even though you receive the HPV vaccine for cervical cancer, the 2 doses or the 3 doses, you should undergo this regular screening programs, because the HPV vaccine does not prevent all types of cervical cancer. It usually prevents the cervical squamous cell carcinoma. And the other carcinomas which can occur are the adenocarcinomas, which are not prevented by this HPV vaccine. So to prevent cervical cancer, HPV vaccination along with regular cervical cancer screening programs with the pap smear or the HPV DNA testing is the recommended thing.
Are there any specific signs or symptoms I should be aware of at my age?
So at your age, you should be aware of any breast lumps or this abnormal vagina discharge from the vagina or excessive mucus discharge from the vagina, to be wary of this breast and cervical cancers. So breast cancers can occur at your age also if you have a strong family history from your mother's side or the father's side.
My name is Rupa, my age is 42. My family history of breast cancer. How does that impact my risk? What proactive steps can I take to reduce chances of developing cancer?
If you are having a family history of breast cancer, first the person who is having breast cancer should be genetically tested for BRCA1-2 mutation. If a person is found to be positive, then you have to get yourself tested for BRCA1-2 gene mutation. And if your things comes positive, even though you don't have any symptoms or any lumps in the breast, you should be under regular screening programs with yearly mammography. And then if your BRCA mutation is positive, you also have the option of, since your family is completed, the kids are completed, you can undergo risk reducing surgery if you are found to be BRCA mutation positive. So what all surgeries can we do to prevent the breast cancer? Either prophylactic bilateral removal of the breasts, or you can get your ovaries also removed, so that the chances of the breast cancer are reduced by 50%. But still continue undergoing the regular screening programs.
Hi ma'am, myself Ishwar. my age is 60 years. What are the potential impact of cancer treatment on my overall well-being, including mental health and quality of life?
Most of the cancers usually occur in elderly because advancing age is the main risk factor for developing a cancer, where the immune systems and the DNA repair mechanisms are impaired. The cancer treatments are tailored according to your age. The lower dose intensity regimens and the lesser side effects chemotherapies and medicines are available, and even the surgeries and radiotherapy are well tolerated. The quality of your life as well as your physical and mental health being is not going to be affected with cancer chemotherapy, because chemotherapy or any form of treatment during cancer, because every treatment is tailored according to the age and modified according to your chronological age and biological age, and the quality of life is effectively taken care of. So we have seen the different questions raised by different age groups. This tells us that the cancers are not uniform across the age. So particular type of cancers are common in the leukemias and lymphomas, or they have the small germ cell tumors and osteosarcomas, the bone tumors, whereas in the middle age groups, they are at risk for developing germ cell tumors. Older adult age group, the breast cancers, ovarian cancers, cervical cancers are common, and in the more elderly, in the males, the prostate cancers, lung cancers, and in the females, the breast and cervical cancer risk continues. And the quality of life is assured across all age groups with the newer cancer treatments.